Hello friends, I am Professor Smitaja from the Department of Humanities and Social Sciences. Let us discuss graphic medicine in much detail because we are discussing the course Health, Humanity and Disability, and graphic medicine is the integral part of medical humanities and health humanities. So as one of the most important aspects counter discourse in graphic medicine is, let us know about it. So continuing from the previous lecture in graphic medicine, counter discourse refers to the use of comics and graphic memoirs to challenge, subvert, or provide alternatives to dominant biomedical and cultural narratives of illness. By blending visual and verbal storytelling, these works restore the language of illness to the patient, moving beyond the sterile objective data of medical charts to highlight subjective lived experience. So, what are the key functions of counter discourse? Graphic medicine serve as a critical tool for assistance in several ways. And first is challenging medical dogma. It critiques the over-reliance on biomedical authority and technology that can sometimes overlook human empathy and the patient's voice. Subvert stereotypes, personal narratives, sometimes called nobody memoirs, dismantle stigmatizing representations, particularly of mental illness, found in popular media and pedagogical text. Third is visual metaphors as counter diagnosis. Authors use unique visual devices such as Ellen Forney's carousel metaphor for bipolar disorder in Marvel to explain internal mental escapes that traditional medical language cannot capture. Empowering marginalized perspective, it provides a platform for identities often excluded from a standard healthcare discourse, such as queer, neurodivergent individual, to represent their own truth. If we talk of epistemological multi-competence, we can say that while there is no single unified academic definition for epistemological multi-competence as a standalone term, it represents the intersection of two distinct theoretical frameworks: epistemic competence, how we know what we know, and multi-competence, the state of mind of someone who knows more than one language or system. In practice, this concept is most often applied in the field of multilingualism, intercultural communication, and educational philosophy to describe the ability to navigate, integrate, and evaluate knowledge across multiple cultural or linguistic ways of knowing. So the core components of epistemological multi-competence is the first one is epistemic competence. This refers to an agent's individual or group capacity to produce and sustain beliefs in reliable ways. According to philosophers like Ernest Sosa, it involves three levels: adroitness, that is a skill; aptness, success due to a skill; and reflectiveness, that is understanding way one is successful. Multi-competence, that is originally coined by Vivian Cook. This is the compound state of mind of someone who uses more than one language. It suggests that a multilingual person is not just two monolinguals in one, but a unique individual with a different cognitive and social system. So the key applications of epistemological multi-competence, the first is intercultural communication. It involves epistemological plurality, the willingness to acknowledge multiple viewpoints and trans-knowledging. This means moving beyond a Western-centric cognitive perspective to value diverse North-South conceptual framework. Second is multiple document comprehension, that is MDC. In modern education, this is the core competence of building a coherent mental representation from multiple sources that may conflict. High epistemological multi-competence allows a learner to evaluate different authors' viewpoint, disciplinary perspectives, and integrate them rather than just seeking a single true fact. Third is professional expertise. In complex fields like health science, professionals develop a synergizing competence that combines a specialized scientific knowledge with critical thinking, knowing how transcending traditional disciplinary boundaries. When we talk of levels of competence in knowledge acquisition based on 4 stages of competence model, a person developing this skill might progress through unconscious incompetence, unaware that other ways of knowing or perspectives exist. Second is conscious incompetence, aware of a gap in knowledge of the existence of other frameworks but unable to navigate them. Third is conscious competence, can evaluate and integrate multiple perspectives, but it requires deliberate effort and focus. Unconscious competence, the ability to seamlessly code switch between different epistemological framework, that is, switching between a scientific and a traditional cultural viewpoint, becomes second nature. While epistemological multi-competence is not a single standardized term in academic literature, it refers to the synthesis of two major concepts: epistemic competence, the ability to process and evaluate knowledge, and multi-competence, the holistic system of a person who knows more than one language. Essentially, it describes the unique way a person who operates in multilinguistic or cultural framework thinks about, acquires, and justifies knowledge. If we talk of multi-competence as foundation, which is proposed by Vivian Cook, multi-competence argues that someone who knows two or more languages is not just a monolingual plus one. Instead, they possess a single integrated mental system where languages interact. So, multi-competence incorporates two factors: integrated mind, the knowledge of second language changes how the first is used and vice versa. Language as a tool for thought, different languages provide different cognitive tools and lenses for perceiving reality. Epistemological dimensions. When applied to epistemology, the study of knowledge, this implies a specific set of skills for handling information. Epistemic thinking. This is the process of thinking about how we know what we know. A multi-competent individual often moves beyond absolutism, one single truth, towards evaluatism. Knowledge is constructed and requires evidence from multiple perspectives. Second is multiple document comprehension, that is MDC. This is a core competence in the information age. It involves building a coherent mental model from multiple sources that might have conflicting viewpoints. Multi-competent individuals are often better at sourcing, identifying where information came from and how different sources interrelate. If we talk of key components of epistemic competence, according to the framework of virtue epistemology, competence is knowledge is structured by three S components. The first is seed, the innermost skills or disposition, the ability to reason or speak a language. Shape, the internal condition of the agent being awake, alert, and focused. Then situation, the external environment, that is, having access to reliable data or clear light. If we talk of practical implications and intercultural communication, it is recognizing that different cultures have different ways of knowing, helps avoid epistemic injustice where certain groups' knowledge is unfairly devalued. Decolonial knowledge concepts like epistemological polylogue advocate for using multiple cultural frameworks to solve global problems rather than relying solely on Western perspective. Critical thinking, multi-competent individuals often develop a meta-competence, the ability to evaluate whether their own first-order knowledge is reliable or biased by their linguistic lens. Epistemic thinking and complexity, it involves recognizing that knowledge is complex, tentative, and often constructed from multiple potentially inconsistent sources. This requires evaluating the credibility of sources and integrating partial information rather than seeking a single final truth. Integrating diverse perspectives, this competence allows for combining different, sometimes conflicting accounts into a comprehensive mental model. It involves understanding how author viewpoints based on different disciplines, methodologies, or worldviews shape the knowledge being presented. Cultural and social context, epistemological multi-competence is crucial in intercultural context, enabling the synthesis of diverse epistemic paradigms, merging Western scientific knowledge with indigenous or local knowledge system. Developing evaluativist understanding. According to model of epistemic development, this involved moving beyond multiplism, the belief that all knowledge is subjective and equally valid, towards evaluativism that which acknowledges subjectivity which while still evaluating knowledge based on evidence and shared standard. Group epistemic competence, and this extends beyond individuals to teams or organizations, emphasizing the capacity to collect, process, and apply knowledge effectively across different disciplines, such as in scientific, social, or environmental decision making. So, what is the significance? It is part of information literacy. It is a core skill in the information age, allowing people to assess information from diverse sources critically. Then, intercultural communication promotes epistemic justice, acknowledging and valuing diverse ways of knowing, reducing the dominance of a single, often Western paradigm. Professional practice is vital in fields like social work and health, where practitioners must navigate complex and competing information. In graphic medicine, epistemological multi-competence is the ability of practitioners, including healthcare providers, researchers, and students, to navigate and integrate diverse ways of knowing. It specifically describes the capability to toggle between and advocate for the role of multiple disciplines, such as the art, humanities, and biomedicine in health-related learning. Core dimension of epistemological multi-competence is graphic medicine fosters this multi-competence by blending visual narratives and scientific information to create a more holistic understanding of health and illness. It does this through a number of dimensions. First, bridging disciplinary gaps. Practitioners learn to move beyond a strictly biomedical lens, objectives and evidence-based, to include the subjective phenomenological experiences of patients and caregivers. Multimodal fluency, it involves managing a multifaceted linguistic visual rhetoric. This requires understanding how text and image interact to convey meaning that neither could express alone, such as the complex temporal landscape of a pandemic. Third is integrating types of knowledge. It supports the coordination of different epistemologies, such as knowing that factual craft specific knowledge, knowing how experiential learning and task specific proficiency, knowing who, how it feels, developing empathy and an emotional connection with the patient's unique life situation. If we talk of importance in healthcare education, enhanced reflection, it encourages critical reflection and a more humanized, socially engaged approach to care. Resistance to epistemic injustice by reclaiming epistemic agency for those with lived experiences of illness, that is chronic pain or mental health challenges. It helps professionals organize and resist medical ableism. Improved health literacy, this multi-competence allows for the creation of more accessible resources that can bridge gaps for populations with low health literacy. Graphic medicine bridges disciplinary gaps by integrating the visual systems of comic art with the principles of narrative medicine, creating a shared space where patient, caregivers, and clinicians can communicate outside the rigid biomedical lens. By blending visual art, writing, and clinical research, it transforms complex medical data into accessible narratives that address health literacy and emotional experiences. If we talk of key mechanisms for bridging the gaps, graphic medicine serves as an enticement to interdisciplinarity through several specific functions, and the first is clinical versus subjective experience, which bridges the gap between objective medical findings and the subjective lived experience of illness, often ignored in traditional clinical settings. Second is health literacy and communication. Visual narratives improve information recall. Research suggests patients remember only 20% of verbal information, but this jumped to 50% when supplemented with visual or written aids. If we talk of professional identity and empathy in medical education, drawing and reading comics help future physicians develop empathy, self awareness, and better communication skills by visualizing challenging patient interactions. Multimodal metaphors in graphic medicine. Metaphors act as multimodal heuristic, connecting internal subjective states like pain or grief with the external world through the interplay of text and image. Intergenerational and cultural barriers. By providing a visual medium, it facilitates difficult conversations across generations, such as end of life care preferences between older patients and their families, and across language barriers. So, interdisciplinary application, if we talk about in the field of graphic medicine, the field is expanding beyond general medicine into specialized areas to solve long standing communication challenges. If we talk of dentistry being used to manage dental fear and simplify complex post operative instructions, chronic pain management, online communities like graphic medicine use web comics, chronic pain is a party to challenge medical ableism and foster solidarity through shared experiential knowledge. Then, public health. Visual narratives are increasingly used to connect global issues like climate change to their local health impacts on families and communities. Academic research. The comic research abstract is an emerging format that combines text, image, and data to make academic findings more engaging for diverse audience. Bridging patient clinicians' perspectives, graphic narratives such as comic biographies of organs, the pancreas, help translate complex medical information into accessible stories that foster empathy and provide a better understanding of the subjective experience of illness. It challenges the detached biomedical lens by centering the personal lived experience of health condition. Medical education and professional development. Graphic medicine is used in medical curricula to teach empathy, improve communication skills, and encourage reflection on challenging patient interactions, diagnostic reasoning, and cognitive biases. It aids in the development of professional identity and self awareness among future healthcare professionals. Accessibility and health literacy. Visual narratives are especially useful for populations with lower health literacy. By simplifying complex medical informations, these narratives improve comprehension and recall, making them valuable for patient education and public health. Interdisciplinary collaboration, art and medicine. Graphic medicine acts as an enticement to interdisciplinarity, merging visual art, writing, and research to create engaging and informative materials. It aids in professional communication in technical fields like dentistry by alleviating patient anxiety and explaining complex procedure. End of life care and social support. It serves as a medium for navigating difficult topics such as end of life care by helping patients and their families align their preferences through visual narratives. Furthermore, it connects individual experiences of pain to broader societal issues, fostering collective advocacy against medical ableism. In medical education and professional development, graphic medicine is an emerging pedagogical tool that uses comics to address complex psychosocial and emotional skills often overlooked in traditional curricula. It is primarily used through two methods: receiving, reading, and discussing comics, and delivering, creating original comics. If we talk of core educational benefits, the first is empathy and humanism. Reading graphic pathography's illness memoir helps students appreciate the patient experience, potentially reversing the decline in empathy often seen during medical training. Professional identity formation. Drawing comics allows students to visualize their evolving roles and process transformative experiences such as the transition to clinician rotations. Critical reflection and bias awareness. The visual medium helps learners identify nonverbal cues and reflect on physician biases and hidden curriculum issues like medical hierarchy. Then comes resilience and wellness. Creative expression through comics serve as a tool for stress relief, helping to mitigate burnout by normalizing shared struggles among peers. In graphic medicine, end of life care and social support are explored through visual narratives that bridge the gap between clinical data and the lived emotional experience of dying. By using comics and illustration, this film makes the invisible aspects of palliative care, such as isolation, grief, and the burden of caregiving, visible and discussable. The role of graphic medicine in end of life care and graphic medicine serves as both an educational tool and a medium for emotional expression, focusing on the following key areas. First is facilitating communication. Visual narratives help patients and families discuss difficult topics like care preferences, advanced directives, and mortality, which are often hard to verbalize. Patient centered education. Comics can explain complex palliative concept, pain management versus curative care in a non threatening way by generating curiosity and participation among patients. Expressing ethical dilemmas, clinicians uses graphic medicine to reflect on the unspoken ethical challenges of intensive care, helping them provide more mindful and empathetic treatment. Social support through visual narratives. Social support is core pillar of palliative care, and graphic medicine highlights its multidimensional nature. Emotional and affectionate support narrative often depict the power of presence, such as holding hands or shared quiet moments, which are vital for patients' well-being. Caregiver perspective, memoirs like Sarah Leavitt's Tonkel about Alzheimer's shed light on the often overlooked social and psychological burden of caregiving, such as guilt and disappointment. Holistic care models, graphic material emphasize that total care must include social services like financial aid or housekeeping to reduce the burden on the healthcare system and improve the patient's quality of life. Dignity and identity by centralizing the patient's personal history and relationship. Graphic medicine support dignity therapy, helping terminally ill individual feel valued and loved rather than just being cases. Key resources and initiatives. So, Graphic Medicine International Collective, a hub for medical students and professionals to share comics focused on end of life decision making and advanced care planning. IAPC's infographics. The Indian Association of Palliative Care uses visual aids to promote a biopsychosocial spiritual approach to end of life care. WHO Palliative Care Guideline official resources from the World Health Organization highlight the interdisciplinary team approach required to support both patient and their caregiver. So, graphic medicine facilitates communication by using visual storytelling, primarily comics and graphic novels, to bridge gaps between patients, caregivers, and healthcare provider. It simplifies complex medical information through sequential art and relatable narrative, making clinical concepts more accessible than traditional text-heavy material. So, how graphic medicine facilitates communication? It is by enhancing patient education. Visual aids in comics improve informational recall from 20%, which I discussed earlier also, and to roughly 50%. So, they are particularly effective for patients with low health literacy or language barriers. So, building empathy and rapport for healthcare professionals, reading and creating graphic memoirs, pathographies helps them understand the emotional weight of a patient's journey, fostering more compassionate care. Discussing sensitive topics, the medium provides a safe space and uses visual metaphors to address stigmatized or difficult subjects like HIV, AIDS, mental health, and end of life care. Reducing anxiety, so graphic novels used before procedures such as biopsies help patient visualize what to expect, significantly reducing pre-procedure stress. Bridging cultural gap, tools like graphic facilitation can break down power imbalances in research or clinical settings, especially when working with indigenous or marginalized communities where written text may not be the preferred communication style. So, the key applications in healthcare are clinical settings. Physicians often use quick drawings to explain conditions like strokes or surgical procedures to families during emergency. Then, medical education curricula like the Exploring Graphic Medicine series at New York University teach medical students visual literacy and communication skills. Public health campaigns for COVID 19 and vaccination use comics to combat misinformation and communicate evolving scientific data clearly. So, key ways graphic medicine facilitates communication by bridging literacy and language gaps. Illustrated stories can communicate vital health information to populations with low health literacy or those who speak different languages, as visual cues provide context that text alone cannot. Enhancing patient comprehension, visual aids like image based communication strips simplify complex instructions such as treatment regimens for pre procedural details, which can improve patient recall by up to 50%. Alleviating anxiety and stress through relatable characters and narratives, graphic medicine can normalize medical experiences, reducing fear for patients awaiting procedures like biopsies or surgeries. Fostering provider empathy for medical students and professionals. Reading graphic pathographies, illness memoirs offers deep insights into the patient's lived experience, helping them move beyond clinical knowledge to a more compassionate, patient centered ethic of care. Facilitating sensitive discussions in familial or palliative care settings, comics can serve as a neutral third party to ease discussion about sensitive or stigmatized topics, including AIDS, end of life care, and mental health. Breaking power imbalances, tools like graphic facilitation, where discussions are documented in real time as large scale postures, can help empower marginalized groups such as indigenous communities by making data ownership and collaborative problem solving more accessible. With this, I wrap up the discussion. This is all for today. In next, we shall discuss some of the more aspects of graphic medicine, particularly memoirs, because memoirs gives a real clue to the patient's health care, and this immensely help the healthcare system also, the clinicians, the medical practitioners also, and this is bringing a kind of revolution to strengthen the relationship between the doctor and the patient. Thank you very much.